Good morning, and welcome to this week's episode of Ask Dr. Murphy. I hope everyone is doing well today. My name is Katie Berg. I'm a research study coordinator with the Havey Institute, and I'll be leading today's discussion. I'd like to welcome and introduce Dr. Robert Murphy. Dr. Murphy, how are you this morning?
Doing quite well, thank you.
Dr. Robert Murphy is the executive director of the Havey Institute for Global Health and the John Philip Fair Professor of Infectious Diseases here at Northwestern's Feinberg School of Medicine. He answers your COVID, infectious disease, and public health questions each week here on the Havey Institute for Global Health Facebook page. Today, Dr. Murphy will be addressing the latest headlines and our lone US COVID statistic through today, January 24th. We invite you to submit any questions or suggested topics down below or via any of our social media linked in the description. Starting with those COVID statistics. Average COVID deaths per day in the last reported week were 86 daily. The same week, first week of 2024, we saw 356 daily COVID deaths. Dr. Murphy, your reaction to those numbers and the state of COVID in the country?
Well, the good news is that compared to last year, it's much better. So that's a good thing, and it shows that we've got more of a herd immunity in the population now, and it's a much less lethal disease. The bad news is it's not going down number-wise at all. We had been down in the 40s and 50s per day, and remember, mortality actually occurs later after an infection because you get sick, mildly ill, then severely ill, hospitalized, ICU, and then some people don't make it. So what I think we're seeing just a little uptick because the flu season and the COVID season, is now over a month old, and so we're getting a slight uptick here.
hmm And there has been a lot of action with other respiratory diseases, including COVID, in this time. Can you fill us in on those?
Yeah, the four of interest to most people, of course, are influenza, the flu, and there's an A and B version of that. COVID, respiratory syncytial virus, or RSV, and norovirus, which is completely unrelated to those viruses, but causes, it used to be called stomach flu, has nothing to do with the flu, but it's a virus that causes diarrhea and discomfort. It rarely causes hospitalization or death, but it's highly contagious. It's the one that a lot of the cruise ships have had significant trouble with. But anyhow, looking at emergency department visits, very high for those diseases, high for RSV and influenza accounting for about 18.8% of visits to the emergency room, COVID at about 6.6%. And this goes along with the wastewater surveillance sampling, which is high around the entire United States. Norovirus is also ticked up. CDC reported 91 outbreaks very recently with norovirus. And remember, norovirus, there is no vaccine, there is no treatment. You just have to, slug your way through kind of a nasty abdominal type infection.
hmm Things to look out for. Just make sure to keep washing your hands and try to be as clean and as safe as possible. But we had some really, really big news this week with massive global health implications. The United States will be exiting the World Health Organization, WHO. Can you tell us about that decision and what it means for us and the rest of the world?
Well, the WHO serves a global function that predominantly helps the countries that are the most in need. They're the poorest. They have high fatality rates for tuberculosis, for HIV. It's the countries that really have a difficult time supporting public health measures. The United States is the biggest donor to the WHO. Now let's put it into a little perspective. The budget for the WHO is somewhere in the $8 billion per year range. Now, that's a lot of money. But if you look at the CDC budget, which only does the public health and epidemiological oversight in the United States, that's 10 billion. And you look at the NIH, which does the medical research, that's $47 billion a year. So we're paying, 18% of a number that's much lower than that. So it's not breaking the bank. Let's put it that way. And why is that important? A lot of people don't know about the WHO. I mean, it's not something that the average person in the United States would, come in contact with. They're going to be dealing with the CDC. But let's face it, these illnesses don't know any boundaries at all. You don't know what's going to come out of anywhere in the world, and you want to be on top of it. And so we're, as a function of contagious disease, we're all in this together. And so to pull out of the WHO, especially after we just had a huge pandemic with COVID that killed millions and millions of people, why would we want to do that? It doesn't really make any sense. It's going to hurt the poor countries, number one. And then number two, we won't get any of those surveillance reports. We'll hear about them, and we can act upon them, but we won't have anything to do with making them or getting them immediately. We'll be in the back of the line. That's really unfortunate, because what is going to happen? Who's going to fill that gap? Guess who? China is going to fill that gap. They have the cash. They got to have huge cash reserves and trade surpluses with the Europeans and with the Americans, North Americans. We want the Chinese the country of China to be the ones kind of handling the next pandemic, or being a big player in that. This is very, very, very short-sighted. The other issue, and we don't have the answer for it yet, is that since the pandemic, the COVID pandemic, the world, the WHO and everybody in all the medical public health people in the world have been working on what's been called the pandemic treaty. In other words, if there is another worldwide pandemic, what steps are we all going to do to work more closely together? You remember back in 2020, it was really chaotic what was going on. Everybody was doing different things. There was no coordination. It was just all ad hoc, and it was very unfortunate and had bad consequences. So this pandemic treaty is just a blueprint for how we're all going to work on the next pandemic together. And they've been working on this for years. Everyone's been criticizing them, like, where's the treaty? Where's the treaty? Well, we finally got the treaty. And so now, are we going to sign that treaty? I don't know. I think that's a big question. We're just pulling out of the WHO. We just pulled out of the Paris Accord on climate change, which incidentally got picked up by former Mayor Bloomberg from New York. But it's going to really be interesting to see, what happens with that. And that would be another really short-sighted thing to do. There's been also some other groups that have had a huge public health impact worldwide. Gavi, that's the International Vaccine group. What's going to happen with that? And also the Global Fund for AIDS, Tuberculosis, and Malaria. And again, who's going to come in? Who's going to come in and replace the money that the United States is not putting in? It's China. China's going to infiltrate itself into these global things. We're going to become very inconsequential in some things that could affect us very, very seriously.
Mm-hmm. And especially things like PEPFAR have been for decades a very, very high point in US bipartisan politics, being lauded by both sides. So it's just really unfortunate.
Yeah, PEPFAR the United States led the charge. Everyone said it couldn't be done. It was the same thing with the Operation Warp Speed, with the development of the COVID vaccine. 10 months from the time they had the sequences available. You know, we have the know-how and the power to really deliver some incredibly technological medical advances that can address these epidemics and pandemics. And if we're going to pull back and just kind of do our own thing, you know, it's just, I don't know. It doesn't really make much sense to me.
Hmm. Now, this process will not happen overnight. Withdrawing from the WHO could take up to a year, over a year. We're not sure. This is something we will be keeping a very, very close eye
Well,
on.
according to the membership rules, it takes a year to get out of it. I mean, how do you operate these international organizations and someone just leaves on day one? Now, but what I've been reading is, will we honor that ruling? I don't know. We'll see.
Yeah, we'll have to wait and see on that one. Very big news, but more very big news that has been going on since 2022 is the avian flu. There has been a lot of news regarding vaccine production potentially, how to test people and be more aware, the surveillance, and also just the status of our poultry industry. Can you fill us in on everything?
Well, avian flu is kind of looking worse and worse every day. And I think this is the big fear. The patient who died in Louisiana in particular had mutations that were very different from other versions of the virus, and looking to make it a more troubling virus in that it looks like it could even be more transmissible and more lethal. So that it's a signal. It still doesn't mean that we've seen significant human to human transmission. But we don't really even know how much there is. Now, what the CDC did just a few days ago was that they posted some guidance that patients that are hospitalized with any influenza A, because there's A and B, bird flu is an influenza A, by the way. So anyone hospitalized for influenza needs to be subtyped, in other words, to test for avian flu. It's not done automatically, all right? And that should be reported within 24 hours. This is totally possible. It's like you can't go, it has nothing to do with the outpatient testing and that. But just looking at the hospitalized patients, this is definitely a step in the right direction. This should have been done a while ago. All right. I mean, I'm just some honest criticism here. You know, it's finally being done, and that's great. I think the next step would be anybody who tests anywhere for influenza A should be subtyped. I mean, it's like this train is ready to go off the cliff. You know, like, what are we waiting for? So anyway, it doesn't cost, it's not like outrageously expensive to do this kind of subtyping. And you know, we'll see. At least now we're going to get the sickest patients. We're going to get some information. But coupled with that, yesterday, I believe, there has been a pause in all government communications to the public, which includes the CDC, which is the ones doing all this kind of stuff, but also the FDA and presumably other government agencies. Now it's a pause so that the new administration can get in there, but how long is this pause going to be? And what are they going to do with this information that our health authorities have been giving us daily for years? You know, I guess we'll see what it is. But it's important that we be able to continue to get that information and to give these guidelines out. You know, for instance, if this pause had been 2 days earlier, they wouldn't have been able to do this guideline change. All right. So it's a risky time right now, and we're in the middle of the flu season, and we've got this avian flu thing hanging over us. And to show you how concerned the government is, and I've mentioned before in other broadcasts that there are 3 licensed avian flu vaccines around the world, and Moderna is another vaccine manufacturer very well known for COVID. But they were given 175 million to do the original work, and they just were given another $590 million to develop the bird flu vaccine. So this is serious, and I mean this is a good thing, and we'll see what happens, and then. Also, we're talking about protecting us from bird flu, humans. This is, of course, very important. But what about the birds? The birds are really dropping like flies and getting culled incredibly. There was a new outbreak in Georgia with bird flu, and it was notable that in one of the counties in northeastern Georgia, 45,500 birds had to be culled, and overall, it's been it's affected over 140 million commercial birds. So it's mostly chickens, and you wonder why the price of eggs and chicken has gone up. They were over 100 million of them have been removed from the market because of this. And for cows, it's now up to 929 infected herds have been involved. Now, the cows don't die from the bird flu like the birds do, but then they can't, you can't use their milk, and, there's all sorts of other restrictions about moving them across state lines and whatever. So it's interesting times.
Very interesting and a very serious situation. Another subject we will, of course, keep up to date on and look for the latest announcements for. But looking overseas, a couple of months ago, we learned about Marburg virus and an outbreak. There has been an announcement of at least 1 case of Marburg virus in Tanzania. Can you remind us what Marburg is and then tell us about that case?
Yeah, Marburg is a different kind of virus. It's not too dissimilar from Ebola. So the thing about, and it doesn't spread through respiratory secretions, so it's unlikely to ever be, a huge major concern. But since it's spread from body fluids, it tends to impact healthcare workers who take care of sick people. Somebody comes in with a fever, and I mean, this could be a number of different things. If it's Marburg, the fatality rate is 88%. This is not good. There was just an outbreak in Rwanda in October, and they actually have a very good public health system there, and they did everything they were supposed to do. They got some support from the WHO. They clamped down. They put in all these restrictions, and it went away. Tanzania, they're arguing whether they really have it or not, or whether it's confirmed or not confirmed. They've got it, but I guess the question is, how many do they have? There's been at least 25 suspected cases, but how many of them get confirmed? Because it's a very different kind of test that has to be done. It's so concerning that the WHO has this emergency contingency fund, and they did release $3 million for them to deal with this outbreak.
Mhm.
So another virus we have to keep our eyes on, but we'll see what happens there.
Absolutely. And an example of the WHO in action. And another disease that the WHO follows, along with many others, is polio. Unfortunately, 4 different countries have announced they had additional polio cases. Can you tell us about them?
Well, there's a worldwide effort called the Global Polio Eradication Initiative that's been trying to eradicate polio. It's an eradicable disease. like smallpox was. However, it just keeps popping up because as soon as the vaccine rates go down in these places where they have it just immediately climbs up. So Pakistan reported a couple cases, um, and including two of the wild type virus. So there's the polio virus that's just in the environment, and there's also the polio virus that you can get from the vaccine. Um, it's rare and usually milder, but still. But I mean, the fact that there's two wild type viruses showing up there, that's not good. Ethiopia had 7 cases, Chad had 3 cases, and Nigeria, the most populous country in Africa, reported 1 additional case. And it's just very unfortunate, but it just shows if we want to get rid of polio, we have to keep up with these vaccine programs and get everybody protected. Otherwise, it's just going to keep popping up in
Mhm.
these areas of the world that have limited resources and limited access to the appropriate prevention measures.
Mhm. Like you said earlier, disease and illness knows no borders. They can pop up anywhere and they can travel anywhere. So, very, very important to stay on top of those things. But that is our time for today. I'd like to thank you, Dr. Murphy, for your time, your expertise breaking down these stories for us.
Great. Well, thank you, Katie.
And thank you all for joining us this week for the Ask Dr. Murphy series. If you have any questions, suggested topics, or comments, please leave them down below or at any of our social media in the description. We'll see you next week and have a nice weekend.